But first, most of us live with constant pressure and call it normal. Doctors don't anymore. That shift is why this conversation is happening today on The Breakfast Club, because stress is now being talked about not just as a mental issue, but also as something that directly affects the heart. And that is where Transcendental Meditation has entered a very serious medical conversation. First, what exactly is TM? It is a silent technique done with eyes closed, no breath control, forcing the mind to focus. It's practiced briefly twice a day and taught in a standardized way. What is important is that this isn't a trend, but has been studied for decades now. Now, this is not the same as most meditation styles people hear about. This practice is described as effortless. There's no controlling the breath and no tracking thoughts. The mind is allowed to settle naturally. That difference matters because it changes how the body reacts, and that brings us to the heart as well. Stress is now recognized as a real risk factor for heart health. Lower stress is linked to better blood pressure and healthier heart responses. This is the part of why cardiology researchers started paying closer attention to stress reduction. Well, why is this conversation happening right now? Medical guidelines are acknowledging psychosocial stress. Doctors are looking beyond medication alone without replacing it. Long-term researchers push stress management into mainstream heart care discussions. So let's take that conversation forward. Tell us why we're having this conversation and what explains the science really behind it all. Joining us first is Dr. Robert Schneider, who has been closely involved in the medical research behind this work. He'll tell us why some of the global heart organizations are recognizing the positive impact of TM and also have included it in their 2025 guidelines in the context of non-pharmacological therapy to reduce blood pressure. Good morning, doctor. Second guest is Bob Roth, the CEO of Lynch Foundation and someone who has taught TM in some of the highest pressure environments in the world. We'll talk about the impact it has had on the several people he's interacted through the years. Thank you, Bob. Good morning to you. We'll come to you in just a bit. First up, I do want to go across to Dr. Schneider. Really tell us about the science, the research he's been part of for years now. Doctor, walk us through the specific evidence that has convinced two of the world's most influential heart bodies to include TM, Transcendental Meditation, in its 2025 guidelines.
Yes, Kritzween. The main point is that cardiovascular disease, which is mainly heart attack and stroke, is the leading cause of death in the world. Not only in the United States, but also in Asia, in India, and every region of the world. So the American Heart Association and the American College of Cardiology and related associations have been looking and evaluating at ways to prevent and treat this epidemic of modern time in the most effective ways. And for the past 50 years, those ways have been primarily using drugs, medications, surgeries when necessary, and lifestyle. And lifestyle has been mainly diet and exercise. However, the big breakthrough in just this past season has been in the latest publication of these organizations. They've recognized the role of the mind in heart health. They call it stress, psychosocial stress, they call it, and how the mind or the brain can cause stress hormones and activation of the stress-related nervous system, and that affects the heart and blood vessels and can accelerate high blood pressure, which leads to damage in the blood vessels and heart attack and stroke. So the role of the mind in heart health was the first part of the big breakthrough just this past couple of months. The second big breakthrough in the review of these top cardiologists and physicians is that you can do something about the stress. And they evaluated stress reduction methods. And in their review, and then in our commentary that my colleagues and I wrote in the Nature Reviews journal called Nature Reviews Cardiology, one of the top cardiovascular health medical journals in the world. We elaborated and it highlighted how stress contributes to heart disease, how stress reduction can prevent or help to prevent heart disease as part of a comprehensive program.
Okay, that's so far as science is concerned, and that's a huge list that you've laid out for our viewers this morning, Dr. Schneider. But for those unaware, let's go back to the drawing board. Let's start with the basics. What is TM? And how is it any different from the other forms of stress reduction techniques we've heard of for years now, yoga, other breathing exercises? How are the two different?
Yes. Well, there are many forms of meditation and relaxation available in the world today, and particularly in India. Many of these practices are popular, and I believe that they all have their value. But when you look at the scientific studies on what happens in the brain during different meditation practices, there are actually different forms of practice with physiological correlates. One form of meditation is a kind of concentration, where you try to hold your mind and focus on a particular thought, particular sound, sometimes a visual. And that concentration form of practice or meditation has its own brain physiology, and there's certain brainwave patterns that they found in the laboratory and certain physiological effects. A second form of meditation is more in the area of contemplation, also related to observing or witnessing. This is more in the mindfulness category of meditations, where you're observing your thoughts and observing the world. And that also has a certain brainwave pattern and certain physiological effects and health effects. And then the third kind of meditation, which Transcendental Meditation is part of, means the name comes from the experience of transcending ordinary thought and activity. In this practice, people experience a state of inner silence, and they call it restful alertness. The mind is resting but awake, quiet but alert and awake.
The thought of each of these, though, is so satisfying, isn't it, Bob? Let's start with you now. You've taken TM to 1.5 million people and counting through your foundation. What are the big changes to people's lives that you've seen through this practice? Tell us a little bit about these stories of transformation.
Well, it's wonderful to be here, and it's wonderful to hear from Dr. Schneider and the positive response from the medical community to his work and so many other cardiologists who've looked at transcendental meditation. I like seeing how it gets translated in the lives of individuals, whether it's top CEOs of corporations like a Ray Dalio, or it's top educators or top healthcare workers. What we find actually within a few days of learning the meditation, it takes about an hour a day over 4 consecutive days to learn it from a certified teacher. And it's just done sitting comfortably in a chair with the eyes closed. It's a silent mental technique. You receive a mantra from the teacher, and the teacher teaches you how to use it effortlessly. What you see within a few days, and the research shows this, is a statistically significant reduction in anxiety, depression, burnout, heart disease. Within several weeks or a month, you start seeing a reduction in high blood pressure. And so the reason for this is not some miraculous whatever. It's because transcendental meditation seems to access a mechanism within the brain and the nervous system to take profound rest at will. This state of restful alertness where the body is rested and the mind is wide awake. And that provides the basis for this constellation of health benefits, reducing stress, but also waking up the creative networks in the brain. And I think that's one reason why some of these top leaders in America are doing this, not just to get rid of stress, but because they have to be at peak performance all the time. And the few minutes of transcendental meditation twice a day awakens that in the brain.
And can you give us examples, Bob? You've had not just these top leaders, top actors, media personalities, musicians, everyone work with you on TM? Do we have a story on top of your mind, any of these bigwigs where TN has actually changed things for good during a bad phase in their life?
Well, yes, I think what it does is it helps we all have ups and downs in our life. I mean, all of us, whether you're at the top of your game in athletics or business or healthcare, or you're just struggling to make it through those ups and downs. And what we need is that ability to be anchored within ourselves, to be established within ourselves, what the doctors call a calming of the fight or flight response and a waking up of that parasympathetic nervous system. So for example, Mr. Ray Dalio, who runs one of the top hedge funds in the world, he said that what the meditation has allowed him to do is to slow everything down. He says almost like a ninja, where things, instead of coming out fast, he can slow things down, he can see them clearly, and he can make the decisions that are going to impact just not himself and his family and his business, but really the whole world. We now have hospitals in the United States that are paying for all of their doctors and nurses to learn Transcendental Meditation as part of a wellness program. And I think this is the future. I think you're going to see Transcendental Meditation covered and part of insurance companies and wellness programs within it's already happening, but within a few years, doctors will be able to prescribe Transcendental Meditation and have it covered by their insurance carrier.
Lovely. I do want to go across to Dr. Schneider once again. Doctor, can people access or include TM in their daily routine realistically without special training or guidance? Is it easy for one and all, or is there a particular way of going about it or introducing yourself to the practice?
TM is very easy to learn and very easy to practice, but it's a precise technique. It requires personal instruction. There's a 4-step course, 8 hours or so. So no, it cannot be learned from a book or a video or something like that. It requires a teacher to be interacting with that can teach you according to your personal needs and characteristics. And then there's a couple of group follow-up sessions. And that precision results in its effectiveness.
Bob, a lot of people struggle with just settling down, slowing down, and taking that first step. Is that any easier in the case of Transcendental Meditation, and how would you suggest one goes about it? A lot of people find the first step in itself very difficult, to just take some time out, not think about anything else, be seated and actually get into a practice like this.
First of all, these are wonderful questions. And yes, many people question, not just in America, but all over the world. They say, I've tried meditation. I find it difficult to do. I can't control my mind. I can't clear my mind of thoughts. I really can't get into it. I believe it will be helpful for me. I like to use the example of a cross-section of an ocean where you have choppy waves on the surface, but the ocean is silent at its depth. And in the same way, our mind is like that. Surface of our mind is the gotta mind. All the thoughts, worries, concerns that we have, type A thinking just all the time. There are many meditations that try to bring calm to the mind by stopping the thoughts, just like you try to bring calm to the ocean by stopping waves. In Transcendental Meditation, we recognize that there's a vertical dimension to the mind, just like there's a vertical dimension to the ocean. And deep inside every one of us right now, you, me, everyone watching, family, friends, there's a level where our mind right now is already calm and settled and peaceful and wide awake. We've lost access to it. The beautiful thing about Transcendental Meditation is it's an effortless technique that just allows us to dive within. Easily, a 10-year-old child can do it. Anyone can do it. Requires no belief. Could be 100% skeptical, and the technique works just fine to access that calm within us and then all the benefits that come. So I teach a lot of very skeptical people, and I say, fine, be skeptical. It's completely fine. Whatever you've done in the past doesn't matter. Learn this, and then within 1-2 sessions, they say, I can't believe how easy that is. And easy doesn't mean superficial, doesn't mean trivial. It means natural, effortless, profound.
I'm going to ask a slightly naughty question. It's a follow-up to what you've said already. So you spoke of how a lot of skeptical people have come to you, but have some of them even moved away from the practice after having tried it out? What's the retention number like? Of the experience you've had, Bob.
Oh, I wasn't sure you're talking to me or Dr. Schneider. It's a very good question, and it sounds a little bit ridiculous to think that everybody who starts it loves it.
Yeah.
The fact of the matter is, the technique is based on a simple idea. Some meditation traditions say that it's the mind is a monkey, and you have to stop the mind from wandering. The insight from Maharishi Mahesh Yogi, a physicist who introduced Transcendental Meditation, is that the mind is not a monkey. The mind seeks something more satisfying. We like to watch your show. We like to read books that are interesting. We like to eat food that we love. We like to listen to music we appreciate. The mind is drawn to something more satisfying. Inside, very nice place, calm, settled, peaceful. So all we have to do is give the attention of the mind an inward direction, and on its own, effortlessly, it's drawn inward because these deeper levels are more satisfying. Now, everyone can learn it, but life happens. Sometimes there's an emergency in the family or disruption in work or something like that, so people get pulled away from it. But the lovely thing is, once you learn TM, Transcendental Meditation, you have access to teachers for the rest of your life for free. And so I get calls all the time from people who say, by the way, there's thousands of teachers of TM all over the world who are certified to teach this. They say, Bob, it's been a little while since I've been meditating. I'd like to get started again. Within 15, 20 minutes, they're back on track. So it may be that a person stops, but they don't really stop. There's more time between the meditations, but then they come back to it and they're glad they do.
Life happens and then they're back on track. Okay, lovely.
Yeah, life happens.
Okay, let's get back to the health aspect for a while. Dr. Schneider, who benefits the most from TM? You've spoken of the host of things that it does to your body or course corrects in a way. But were there any specific patient populations like stage 1 versus stage 2 hypertension or older adults, let's say, for whom TM showed maximum benefits?
The review committees have pointed out that this stress reduction meditation technique is useful both for prevention and for treatment. If you already have high blood pressure, then this could be a very useful component of your program. But if it's already fairly high, you may need medication, and you should follow a healthy lifestyle, heart healthy lifestyle generally, and this could help reduce the needs for medication. If you have more mild high blood pressure, then this technique as part of your lifestyle program could be sufficient and help prevent the need for medication. And then, of course, the earlier in your life that you adopt this preventive modality, the better it is for you long term, because prevention is better than cure. But if you need the cure, it's also helpful.
Okay. Dr. Schneider, Bob has given us so many reasons to believe, understand, and for all the right reasons why one must opt for a practice like TM. But when people hear about meditation in general, a lot of them link it to the feeling of calm and ease, and that's about it. How does transcendental meditation actually affect then your parameters like blood pressure in the body? So what's really going on physiologically?
Many people have the question about my lifestyle is so busy and I don't have time to stop and slow down. Some people call it the busy business person syndrome. The main idea is that taking a few minutes in the morning and a few minutes in the evening to slow down, take some deep rest and relaxation in this alert way. It prepares you for more effective activity. You can actually be more efficient in your busy life if you start your day in a restful, clear, creative way. And if you finish your day by washing away the day's stresses and fatigues. So it's kind of a way to prepare for activities. So rather than it being frenetic and less coherent and running around, it's starting the day in a more coherent state of mind and body and finishing the day that way. So it actually improves people's efficiency and effectiveness by taking a few minutes of rest twice a day.
Okay, that sounds beautiful. Bob, have you had people come to you say meditation is just spiritual or it's too abstract? And how did that perception change once they took the leap of faith, once they got into this practice? And more importantly, how much of a role does research like this, like the one Dr. Schneider has been working on, play in changing that perception?
Oh, I think research has been absolutely essential in doing two things. First of all, making clear that not all meditations are the same. There's been an assumption even within the scientific community that, well, it doesn't matter what you do. You can, knit, you could do breath work, you could do transcendental meditation, you could do mindfulness. They're all the same. Turns out there's a different brainwave, there's a different procedure, there's a different brainwave signature, and there's a completely different response in the brain and the nervous system to the meditation. So science has been absolutely essential. First of all, I want to pause here by acknowledging Transcendental Meditation has its roots in India, has its roots in this great ancient Vedic tradition. So I think what's interesting is this great ancient wisdom is now coming and is being reflected back by the science of Harvard and Stanford and Yale and University of Michigan, hundreds of research studies conducted on transcendental meditation. And the result of that is the world now has this gift of an ancient, simple practice that can produce within a short period of time dramatic changes in one's own mind, body, behavior, and in the society as a whole. And I feel like the notion, the spirituality is a wonderful, I mean, if you define spirituality as developing the full potential of consciousness, the full creative potential of the human being, that's a wonderful thing. If we're looking at spirituality as a religious practice, that's fine. That's not transcendental meditation. Transcendental meditation is a mind-body practice that wakes up the full potential of the brain, the mind, and also allows us to live as healthy a life as we can in these very turbulent, trying times. As far as time goes, if I could say one more thing. One time I was teaching a father and his 15-year-old son, and the father said, I believe transcendental meditation could be very healthy for me. I just don't have the time. And the 15-year-old son said to his father, Dad, there's 1,440 minutes in the day. If you don't have a few minutes to take care of your brain, so much of health is from the neck down. If you don't have a few minutes to take care of your brain, he said, Dad, I think you have to rethink your priorities. And I think that's what's happening now. The idea of meditation TM is no longer a luxury. Now it's something that's essential for a healthy, happy, integrated life.
And personally for you, Bob, at what point did transcendental meditation move from being a personal practice to a life's calling for you? So much so that you're taking it to millions and millions with each passing year.
My father was a medical doctor, my mother was a school teacher, and I actually wanted to go into politics. I wanted to be a United States Senator to change the world. And I'm my father's son. My father was a researcher and a doctor, and I'm very skeptical just by nature. So when I heard about transcendental meditation over 50 years ago, I was very skeptical. But I said, I'm not cynical. If I'm cynical, I don't do anything. I said, well, I'll try it and I'll see if I like it. And I did it, and it was so profound that I thought, okay, this is a good thing. And then after a few months of doing it, I thought, well, this would be, my father's a doctor, this would be something that would be very healing for people. And then my mother was a teacher, and I thought, well, this should be brought to the schools. And my interest was in sort of scalable public health through politics. And I thought, well, why don't we bring this to the healthcare system? Why not put this into the covered by insurance carriers and really transform the health and well-being of society from the bottom up? So it didn't take me too long. I really enjoyed it, and now I have the fortune of running this foundation in conjunction with there's a whole international Transcendental Meditation organization in India. It's a very strong organization. So it was natural, what is the word, dharma.
Okay, lovely. So next time we're going to have you join us here in our studios and talk about TM, hopefully. Both you and Dr. Schneider. Lovely. Dr. Schneider, if someone were to ask you, and this is so relevant because day in and out we're breaking news on the unfortunate deaths that are taking place at a very young age, all because of cardiac arrest. If someone were to ask you if TN could have answers to the shocking cardiac arrests even doctors find hard to explain, what would you say?
It's been found that heart health begins early in life. High blood pressure begins often in youth. And now in recent years, all over the world, and in India, which has twice the rate of cardiovascular disease as many high-income countries, this condition is found earlier and earlier in life. So what I see happening over the next few years is the youth beginning to take care of their mind-body health with meditation, with young adults attending to their mind-body health, as well as older adults, but moving more towards prevention. So those men and women who have heart attacks in their 30s, it's more and more common, very unfortunate, and the way to deal with that is prevention is worth, an ounce of prevention is worth a pound of cure, or a gram of prevention is worth a kilogram of cure. I see it starting early, and I see this as a lifelong component of a healthy lifestyle to help the young people stay healthy and then live long lives, and help the older people live longer and happier and better also.
Okay, lovely. We want to wrap up this conversation on that very positive note, Dr. Schneider. But one last question to you, Bob. Was there a moment when science finally explained something you'd already experienced through Transcendental Meditation?
Yes, I think early on, 50 years ago, if you would have said that stress could be a causal factor, intuitively you just have to feel. I mean, you must feel it too at work. If you're feeling tension inside, anxious inside, it affects your health. So when this first research came out from Dr. Schneider, in the 1980s, showing that this could impact heart health, I thought, well, it's about time. I mean, it's common sense, but it's about time. And I should make one last comment, and that is the Worldwide Transcendental Meditation Organization now, following the passing of Maharshi, is run by a medical doctor and a neuroscientist, Dr. Tony Nader, who's an MIT and Harvard-trained neuroscientist. And so the focus here is on world health, global health. And I think that we're going to see within the next few years Transcendental Meditation being incorporated into the healthcare systems, because it does something that pills don't do. It addresses this foundational factor of chronic stress that just doesn't go away from a night's sleep or a run or eating properly. And I think we're seeing it's going to be a phase transition, a new paradigm shift, and it bodes well.
And well, it is, after all, coming together of the mind and the body, something that we've heard of for years altogether. So this shouldn't be surprising, really. Bob, Dr. Schneider, thank you so much for that wonderful conversation, for the beautiful perspective you brought to the table this morning. It was lovely that both of you could join us. Thank you.
Thank you very much. It was a wonderful interview.